Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the knee. It is Lachman Test. Yes, that test that we know that you use for checking for an ACL tear. So this test was described first time in a paper in 1976 by Dr. Joseph Torg, and he was just talking about checking for ACL instability with the anterior drawer and this new test. And he said this test, well, it's probably a little bit better than the anterior drawer. One, because of the position of it, it's more one of comfort for the person that you are doing it on. Also, you don't have the forces from the hamstring being involved, pulling back on the tibia. And additionally, you have a flat surface there in the tibia, so you just get an unobstructed movement. Now, you may be wondering, why is it called Lachman Test? Well, so Dr. Torg said that this test was taught to him by Dr. John Lachman, who was an orthopedic surgeon at Temple University, and he utilized this test as a simple, reliable way to check the instability of the ACL. So he named the test after him. So let's get right in on how to do it. To perform this test, you have the person lying on their back, just like Mateo is here. And then what you're going to do, you want to bend the person's knee to about 20 degrees, which is not very much, roughly right around there, 20 to 30 degrees has been in there. Now, I will say in the original article by Dr. Torg, he said that Dr. Lachman would do this at full extension or at 15 degrees of flexion. So a little bit less, so 5 degrees difference, or maybe even a little bit less in there. That's how he would perform it. But we've had it more just kind of discussed along these routes. So you have the person's knee bent to that roughly 20 degrees, stabilize the femur, grasp that tibia to hold back behind it. You can even put your thumb there on the tibial plateau, and you provide an anterior translation of this tibia, so try to bring that forward. What you are looking for is a translation so that that tibia just shifts forward, and with as in the original paper, a mushy or soft infeel, meaning that, okay, that there is some instability in the ACL and this test is positive. So getting into the research, there is a ton out there, a lot of stuff, and a lot of it says that this is a very good test to utilize if you want to check the ACL. And some people even say it's like the gold standard. But I will say that there is a paper from 2022, and they were comparing the Lachman test to the anterior drawer, pivot shift, and the lever test. And they said, just kind of based upon everything that they found, that they said, well, this test may not be as diagnostically accurate as we once thought, especially in like post-acute injuries or with like a complete ACL tear. They said, it may not be as good. It was still pretty high, and you can look at the paper. I got it referenced down below. Like, it was still pretty high, but they said, maybe it's just not there. But overall, the researcher said, if you look at like what happened with the person, their clinical presentation, and if you do these tests and they're positive, it's probably most likely that they have a tear. But if the tests are negative and you still suspect one, that you do need to do imaging on it to confirm. So anyway, there you go. That is Lachman Test. That oldie but goodie, as we can say there. So let us know, what do you think about it? Do you use it? Do you like it? Do you find that it is pretty accurate? Anyway, let us know down in the comments below. And like Mateo always says, take care of yourself, take care of your patients. We'll see you next time.